Mr. Speaker, March is Social Work Month, and the 2023 theme set by the U.S. National Association of Social Workers is Social Work Breaks Barriers. This theme highlights and proclaims how social work breaks the barriers that prevent people and communities from thriving, using advocacy and services to remove obstacles for persons who are in need. Mr. Speaker, I rise this morning to share with my honorable colleagues that in recognition of Social Work Month and keeping with this theme, the Department of Child and Family Services held a 3-day conference this week for their staff, which commenced on Wednesday, March 22nd, using an adaptive theme, Breaking Barriers Beyond the Trauma. The conference will equip DCFS staff with both instructive and practical tools that will steer their thinking towards becoming more trauma-informed and trauma-responsive with the intent of breaking barriers of resistance. Mr. Speaker, I was delighted to officially open the 3-day conference on Wednesday morning, the first of its kind for the department, and welcome the DCFS staff and invited guests. The conference offered a dynamic lineup of overseas and local presenters who engaged and challenged the DCFS team to work differently as social workers when lending support to children who have endured painful experiences. Staff were encouraged to develop a trauma-informed lens and be positioned to provide the relevant services at every level to support our children who have been traumatized in any way. Mr. Speaker, our children's experience all types of trauma in life. The Bermuda Adverse Childhood Experiences ACE study, undertaken by the Bermuda Health Council in 2018, revealed that there were 13 adverse childhood experiences of both children and adults comprising of trauma and chronic disease. So what is trauma? A person may experience trauma as a response to any event they find physically or emotionally threatening or harmful. According to Bermuda's ACE study, trauma could stem from experiences such as emotional or sexual abuse, road traffic accidents, physical or emotional neglect, racism, poverty, mental health, parental separation, domestic violence, incarcerated relatives, or substance abuse. Additionally, Mr. Speaker, trauma can have long-term effects on children's well-being in that they may feel overwhelmed, helpless, sad, fearful, shocked, or have difficulty processing their experiences. Mr. Speaker, it is within this context that a high caliber of professional psychologists and social workers were invited to the Breaking Barriers Beyond the Trauma conference this week to impart their expertise through training and sharing of the impact and effective treatment of some of these traumatic experiences our children go through. Mr. Speaker, the keynote speaker for the conference was Dr. Ebony Webb, a clinical psychologist based in Tennessee, United States. Dr. Webb, a specialist in dialectical behavior therapy, set the tone for the conference in her opening address by taking participants through a deep dive into understanding the root of trauma. She shared how trauma is transferred generationally, and if not treated, adults can live out of their trauma and pass it along to their children. Dr. Webb emphasized the importance of breaking barriers early so that patterns in our lives are not repeated. She also shared how trauma is a thief and treatment must be multifaceted to include top-down and bottom-up processing techniques. Mr. Speaker, other overseas guests who presented at the conference were Ms. Kiva Harper, a licensed clinical social work specialist in trauma-focused psychotherapy and assistant professor in the practice in the School of Social Work at the University of Texas, and Mr. Hanif Benjamin, a clinical traumatologist and clinical therapist, also president of the Trinidad and Tobago Association of Social Workers. Mr. Speaker, our very own Bermudian raised presenters included Dr. Kelly Savory, a trauma and counseling psychologist and a cognitive analyst therapist who currently practices in the UK. Dr. Jana Otterbridge, a counseling psychologist and owner of Mayvera Wellness. Dr. Teralyn Tyrrell, coordinator of the Child Development Program in the Department of Education and former senior director in Government Affairs and Policy, Voices for America's Children. Dr. Jennifer LePage Hamel, clinical psychologist at the Child Development Program in the Department of Education, and Ms. Latoya Bridgewater, yoga expert and owner of Empowered Me Wellness. The presenters offered a cross-section of trauma labs covering domestic violence and safety, working with trauma-related hurt, the impact of prenatal stress and postnatal trauma on child development, understanding emotional disturbances in youth and adolescents, helping young people understand and regulate their survival responses, children who experience trauma, caregiving for residential care facilities, and self-care in the workplace. Mr. Speaker, there are just over 100 staff in the Department of Child and Family Services. The majority either are trained social workers, social work assistants, residential care officers, or officers and administrative staff who work very closely with social workers. I am pleased that all were able to participate in the 3-day conference as the trauma labs were offered on a rotational basis each day. Mr. Speaker, I commend our very own clinical manager at the Department of Child and Family Services, Dr. Zena Zuhl, the visionary for Breaking Barriers Beyond the Trauma Conference, and heartfelt thanks to the Solution-Focused Advocacy Committee who worked diligently as a team to bring the vision to life. Maureen True, Terry Lynn Richardson, Anisha Peets, Simone Romaine, and Shadrina Hassel. Well done, team. I also extend my sincere thanks to the Director of Child and Family Services, Mr. Alfred Mabry, and his senior management team for their leadership and for ensuring that all staff were able to participate and glean from the wealth of information presented at the conference. I believe their toolboxes have been expanded with new and improved methods and techniques to lend greater effective support to help Bermuda's children who are placed under the Director's care. Mr. Speaker, in closing, allow me to reiterate sentiments I have expressed before in this House, this honorable House. The staff at the Department of Child and Family Services are hard workers and have a deep commitment to the children and families of Bermuda. While it may seem to be the most thankless professional work, the impact each staff member has when assisting those they come in contact with is priceless. I'm very much grateful that they do not hold back from functioning in their various gifts and callings. Thank you, Mr. Speaker.